collar care in sitting with the assistance of one person. The intention of this video is to provide a reference guide for patients and their relatives who have been fitted with a neck collar by a healthcare professional from the Trauma and Orthopaedic team in the Cardiff and Vale University Health Board. This video will cover why the collar is needed, how to remove the collar, how to wash yourself and the collar, and how to reapply the collar. You would have been advised before you were discharged from hospital whether to fit your collar in lying or sitting and with or without assistance. This video is intended only for use by patients who have already been taught collar care in hospital in a sitting position with help from one person. If you were told to fit your collar in a different position to this, please go back to the main page and select the video that is relevant to you. Why are you wearing a collar? A neck collar is designed to limit the movement of your neck. They are most commonly used for spinal fractures of the neck, but can be used for other reasons such as supporting your neck after surgery. Limiting the motion of your neck is an important part of your treatment and will prevent further damage. Not being able to shake or turn your head may seem unusual at first, but the collar is intended to keep your head still and to keep your neck in the proper position which is best for healing. Will there be complications from wearing a collar? Wearing a collar does not prevent all movement of your neck, it just limits it. It is important that you are aware of your posture and ensure that the collar is fitted tight enough to give you the support your neck needs. It is important that the collar is removed daily to wash, dry and check your skin. If the collar is not on tight enough or the pads are not cleaned regularly, it can rub and cause pressure sores or skin irritation. Wearing a collar may cause some weakness of the muscles around your neck, as the collar will essentially be doing some of the work for these muscles. However, when you no longer require your collar, you will be advised to gradually move your neck and your muscles should strengthen through the gradual return to normal activities. If you require ongoing physiotherapy, you will be referred. Initial fit. Your collar would have been sized and measured by a qualified healthcare professional. The product you have been fitted with may differ from the one being shown in the video, however the process of fitting remains the same. You would have been fitted with a product that best fits your condition, size and shape. Before you start collar care, be organised and have everything you need around you. For example, spare clean collar pads, a flannel or washcloth, shaving equipment, soapy warm water and a towel. Sit on a firm, stable surface with space around you to allow the person assisting to be able to access you. The person assisting with collar care needs to be mindful of their own posture. For example, bend their knees and try not to twist too much. When removing and reapplying the collar, the patient must keep their neck still and in a neutral position at all times. Before removing the collar, it is a good idea to take note of where the straps are in relation to the neck, as this will help when it comes to reapplying the collar. To remove the collar, hold the front piece of the collar and undo the Velcro straps one at a time. Remove the front piece of the collar and then the back. Gently wash and dry the neck, checking the skin for any redness, marking or pressure areas. Please ensure that the skin is completely dry before reapplying the collar. If you are concerned about the integrity of the skin, please contact your GP. The collar will come with spare pads. This is so the used pads can be removed and the second clean set applied. The pads should be changed and washed every day. It is easier to remove the pads one at a time and replace with the appropriate shaped clean pad as you go along. Adjust the pads as needed to make sure no plastic touches the skin. Once removed, the pads should be hand washed in warm soapy water and left to air dry. Ensure that they are completely dry before reapplying. To reapply the collar, ensure that it is the correct way up by looking at the writing or arrows on the panel. Place the back piece around the neck, making sure that it is centered evenly. Attach the back straps loosely to the front piece, ensuring that the chin is sitting on top of the chin rest. Then hold the front piece securely and curl the sides around the patient's neck. Alternately tighten the straps one at a time until they are in the original position and even on both sides. Check the fit of the collar using these key points. Check that the bottom of the collar is flat to the chest bone, that the patient is able to swallow and breathe normally. The collar should be in contact with the chin, and there should be 1 finger width from their chin to the edge of the collar. The Velcro straps should be in alignment and equal in length. There should be no skin in contact with the plastic of the collar. These checks should be done in lying, sitting and standing. If you have any problems with the collar, please do not hesitate to contact the ward that you were discharged from to discuss with a nurse or physiotherapist. Thank you for watching.